tell you should take it now, this date, or whatever it is, because everybody's situation is different. Okay? We give you options, but we're not going to tell you when is a good time for you to take those benefits. Right? And one of the decision factors could be because of work. Right? Can you work and still get your Social Security benefits? Yes? Yes. Yes, you can, right? You can, but if you're under the full retirement age, there is a limit, or I want to say a cap, on how much you can earn. So if you're under the full retirement age, if you want to start collecting your Social Security benefits, you cannot earn over $15,120 this year. January 2013 to December 2013, you cannot go over $15,120. If you earn over that amount, then Social Security is going to withhold $1 for every $2 you go over that $15,120. So here in Hawaii, if you work full time, then you're under the full retirement age, probably not going to be able to pay you, right? And that's where the earnings estimate comes into play. Okay, so if you file for your benefits online, the system's automatically going to know that you're under the full retirement age. So it will ask you, are you going to continue to work? If you say yes, then it's going to say, we need an estimated earnings from you. How much do you expect to earn for the whole year? If somebody plugs in 0, and if you meet the age requirement, you're under the full retirement age, we're going to start paying you. And for some reason, some people think we're not going to find out, but we do all the W-2 forms. So your earnings are going to get posted to the record, and the person earns $60,000. Okay, then you're going to get a nice overpayment letter from Social Security that says, you told us you're not going to go over $15,120, but you earned $60,000. You need to pay us back. You're overpaid. And you don't want to be paying us back when that's something that you paid into, right? You want to be collecting. Okay, and for another thing, if we cannot pay you benefits, then you probably should not be filing yet. Okay, or if you're going to reduce your earnings, it's going to be close to that amount, then maybe you might want to consider it. It all depends on your situation, right? Because what happens is let's say somebody puts an estimate of $16,000, and not too much more than the $15,120. So what will happen is that we will withhold probably 1 month of check, because we can't cut half a check. So 1 month of check, because the person's going over, we'll hold back 1 month of check. Okay? And at the end of the year, when they file their taxes, the earnings gets posted to the record. If they earn less than that, then we can at least go back and pay them that check that we withheld from them. Okay? So there is possible that we might be able to pay the person, not maybe the whole year, but for some months. And again, it depends on what your situation is. Okay? Not everybody is going to stop working the beginning of the year or the ending of the year. So sometimes people think that they're going to work till the end of the year, but maybe they get tired of work already. And they're of retirement age, and so they say, well, I can retire. I'm going to put in my retirement papers. Okay, so effective July 30th, I'm no longer employed. I'm putting my retirement papers. So effective August 1st, I'm no longer employed. So we still have August, September, October, November, December, 5 months to work to the end of the year. So let's say from January through July, though, my earnings were $60,000. But remember, starting August 1st, I'm no longer working. August, September, October, November, December, I'm not going to be working at all because I've stopped working the last day of the month in July. Then we can pay you starting from August. There's a possibility that we can start your payments in August. So the very first year, we can try to either use a monthly test or the annual test, whatever is most beneficial. Whatever we want to pay you on, whatever works best, that's what we're going to use. Now, it's not going to work for those individuals who are going to continue to work, but just go part-time. Okay, then we will use the $60,000 all the way through the end of December against you. This is for individuals who are going to stop working. So then that way, the following month, right after that, they're not going to be working, we can pay them for those months, right? The year somebody reaches the full retirement age, there's also a limit, which is $40,080. Kind of confusing, but just imagine, okay, this year, 2013, my full retirement age is 66. So I'm going to be 66 this month in August. So the months prior to my full retirement age, we're only talking about what? January through July, right? Because August I'm going to be 66, that's my full time. Now let's say I started my online application in July, 1 month before my full retirement age. If my earnings the month prior to my full retirement age, if my earnings are below 40,080, so in this case, this example, January through July, if my earnings are below 40,080, then technically Social Security could start my payments in July when I started the online application, if I wanted to, 1 month early. Okay, but will my benefits be reduced? Yes, it will be reduced by 1 month. Okay, but you have that option there. Okay, so that option there on that 40,080 is if you want to get paid any months before your full retirement age. In that same year, you're going to reach your full retirement age. If you want to get any payments the months before, then you have to stay below that 40,080. Now, if you do not want to collect your benefits not even 1 month before your full retirement age because you want 100% of your benefit, so I'm going to be 66 this month. I started my online application in July, but I made it effective with August. Then Social Security doesn't care how much I earn the months before August or the months after. I can earn $1 million and still collect my benefits. The only time we care about how much you earn from work is if you start collecting your benefits before your full retirement age. Same applies to those individuals who, let's say, did file for the benefits before their full retirement age, but they were careful to stay within that limit. Careful to stay within. The month they reach their full retirement age, then the cap is lifted. If they want to go back to work full time, they can and still collect their Social Security benefits. Right? Okay. Now, who else is entitled or may be eligible for benefits? Your child. If you have a child under the age of 19, your child may be eligible under the retiree's record for Social Security child benefits. We don't pay beyond high school. The only time we pay beyond high school is if the child is found to be disabled prior to age 22. And in some cases we do. We have adult disabled children that are on their parents' record for the rest of their lives. Your spouse. One thing to point out, okay, regardless of whether it's a retiree, a spouse, or a child, if they are filing for benefits before their full retirement age, and if they're working, they cannot earn over that $15,120. It applies to the spouse, the retiree, and even the child. Okay. Even the child, because sometimes children might work part-time. For a current spouse, there is a duration of marriage, 1 year from the date of their filing. They have to be married. At 62 or older, the spouse may be eligible. Not all spouses are going to be entitled under the retiree's record for Social Security benefits. At any age, if they're caring for a child under the age of 16 or disabled. Now, if you have a spouse and your spouse does not have 40 credits, they never maybe worked maybe a little bit, but not enough to get 40 credits, then yes, your spouse at 62 may be eligible under the retiree's record for Social Security spousal benefits. Will it affect the retiree's benefit? No, it will not. It's not going to reduce the benefit amount whatsoever. Now, if your spouse is under the full retirement age, and let's say your spouse also worked and paid into the system too, so your spouse has enough credits under his or her record. If they are filing under the full retirement age, they have to file under their own record first. The only way they're going to be entitled for any additional benefits from the retiree's record is if their benefit amount was less than the half of the retiree's full benefit amount, which is, it may be. So that's what I'm saying. Not all spouses are going to be eligible or entitled.
Because what again? Why would we not be entitled again? I missed it.
In order for, if the spouse is under the full retirement age, if they have enough credits under their own record, they have to file under their own record first. The only way they're going to be eligible under the retiree's record for any additional benefit is if their benefit amount from their Social Security retirement is less than the retiree's full benefit amount. Yeah. Okay. If it's not, then they're going to be under their own record, and the retiree's under their own record. If the spouse is full retirement age, if the spouse is full retirement age, then they will have a choice of whether or not they want to take 50% and collect spousal benefits while they delay collecting their own benefits so they can accrue delayed retirement credits. Okay, and then switch over at age 70 to their own retirement benefits. The only time a spouse can do that is, or have that choice, is when they are full retirement age. You can also, with everything, there's a risk, right? When people delay things, there's a possibility that they're going to pass away and they see nothing. Okay, so I'm just giving you options. These are some of the options. Okay. If, let's say, your spouse also, let's say the retiree also wants to get delayed retirement credits. Okay, so let's say you have a husband and wife. They both have to be full retirement age to do this. Okay, to do this option, they both have to be full retirement age. So let's say, and one of them has to file first, and they both cannot be getting spousal benefits. One person can only get the spouse's benefit. Okay? But both can delay collecting their own benefit to get that 8% increase per year. So let's say the husband and wife is both full retirement age. If they're both full retirement age, let's say that the husband files first. If he's full retirement age, he files first, but he wants to also get delayed retirement credits. So and he's still working, so he's gonna file first, and he's gonna ask for his own benefits to be suspended. And then his wife is gonna file that 50% spousal benefits. And she's going to delay collecting her retirement. So both of them get the delayed retirement credit. And then when he's ready at 70, he's going to say, I'm going to file, now I'm going to start collecting my benefit. So I get the delayed retirement credits. And then his spouse is going to say, well, I'm going to switch over to my own benefit at age 70. So I get my delayed retirement credits. Yes?
Kind of complicated. Do you have anybody who can help you on a case-by-case basis to determine if
Yes. Yes, so if you don't feel comfortable doing it online, of course we do have claims representatives. You do need to call or toll free 772-1213. You need to call them and make an appointment so they can look at your record and discuss that option if that's what something that you want to do.
you can do that by phone?
Yes, you
Have
can.
a conflict.
Yes, you can. Yes, you can.
I have one
Yes.
question. In what scenario would it be where the younger spouse, the wife would file first and the older spouse would wait? When would that ever be beneficial? When the younger spouse, the wife files first before the husband, who's a little older. When is that a beneficial thing?
When is that? That's on a case by case. That's each individual person's.
But it's possible
Decision.
that that is a good idea.
That's up to you. That's up to each individual. We can't tell you it's a good idea or not. That's the benefits that if you're entitled to, if you want to take it early, and if you're entitled to them, then you can apply for those benefits. Social Security is not in the business of telling you which plan is good. We're going to give you these options, and you're going to have to choose what is best for you. We actually even did away with what we call like the break-even point too. Okay, because when I used to take claims in the past, and we did calculate, saying it was going to take you 17.5 years to make it, we can't do that anymore because of what the financial situation is for some people now too. So it's on a case-by-case situation. You will have to make the decision for yourself, or speak to a financial advisor if you have a financial advisor that you can talk to. Okay, ex-spouse. There is a duration of marriage for ex-spouse. The marriage has to have lasted for 10 full years, and the person that's wanting to collect benefits on the retiree's record has to be currently unmarried. Now, not all cases are ex is going to be entitled. Okay? And if an ex is entitled under your record, it's not going to reduce your benefit whatsoever. Okay? So it is not uncommon to see a retiree on the record, the current spouse and the ex-spouse all on one record collecting benefits without any of them knowing, because it doesn't affect any one of their benefits. Okay, so not to worry. So if they are eligible, then we will ask to see additional documents from them, and we'll let you know as well. Right? So spouse's benefit computation is about 50% of the worker's unreduced benefit, and there is a reduction for early retirement, regardless of whether you're a spouse or a retiree, and it does not reduce the payment to the worker. Survivor benefits. Okay, again, a child is entitled or eligible for benefits before the age of 19. If they're disabled prior to age 22, then the benefits could possibly continue after high school. One thing to point out about survivor benefits, if the deceased worker was receiving a reduced benefit, the survivors will never see that 100% benefit because it's already reduced in the calculation. Okay, one thing to point out. Widows or widowers, the earliest that they can start collecting benefit is at age 60, 60. If they're disabled, as early as age 50. Widows and widowers also have the option of switching from one record to the other. You're sort of like preserving that other record so you end up with a higher record. So let's say you have a widow and she is 60. She has 2 minor children that are still in high school. They're getting survivor benefits under their late father's record. And so she decides to take benefits at 60. She's still working, but she's working part-time. So she's not going to earn over $15,120. Remember that threshold? Because she's under the full retirement age, right? So same applies. Okay, so she starts collecting widow's benefit at a reduced rate. But she's also worked 40 years and paid into the system. So she's got 40 credits. What happens to her own retirement benefit? Does she lose it because she started collecting widow's benefit? No, right? What's the earliest that you can start collecting retirement benefits? 62, right? Okay. 62 is early. So she's getting widow's benefit at 60. She inquires at 62 what her benefit would be like under her own record. And it's not higher than her reduced widow's. So she's going to wait, right? And she's going to look into it at her full retirement age. And then, by then it's a little bit more, but it's not that much more. She says, I can still live off the reduced widow's benefit. Then she's going to get her delayed retirement credits, right? And then by 70, when she inquires, it's a lot higher than her widow's benefit, her reduced widow's benefit. So at that time, she's going to file for her retirement benefits at age 70. Okay, so you're switching from one record to the other. She could have done it the opposite way around, but if she did it the opposite way around, she would have had to, what's the earliest retirement? 62, right? So she would have had to wait another 2 extra years. But she could have done that. She could have taken her reduced retirement benefits, and even for widows and widowers, if you delay, if you wait to collect it, then you're going to get that delayed retirement credits too. So she could have taken her reduced retirement benefit at 62 and then switch over to her widow's benefit at age 70. So you're always kind of preserving that other record so you get a higher benefit amount. We're never going to send you, we're never going to put you from a higher record to a lower record. Okay, if you have a higher record, sometimes some people, they're going to end up on widow's benefits because it's never, their retirement benefit is never going to be higher. Okay, but we're going to look at those things and we'll let you know. We're never going to make it a reduction. We don't want you to get less, right? So we're always going to put you on whatever the higher benefit is going to be. At any age, if you're caring for a child under the age of 16 or disabled, remarriage after 60, I did have a lady like that. I always give her as an example. The 18 years I've worked, I did have one lady where she wasn't quite 60 yet, but she planned it out and she was going to collect widow's benefit at age 60. And then she called me out of the blues and said, oh Jane, I met a really nice guy, he's a lot younger than me, true story, and she said, we're planning on getting married. What's going to happen to my widow's benefit? Again, Social Security cannot tell you what to do. We're just going to give you the information. So I said, well, if you get remarried before you celebrate your 60th birthday, then you are no longer considered a widow. So you're not going to be able to collect widow's benefit. If you get remarried after you celebrate your 60th birthday, then you can get widow's benefits and then be remarried to this other person. So she said, okay, thank you, and that was it. So I don't know what she did, but okay. Divorced widows and widowers may also qualify. So again, you can have a widow, widower, divorced widow, widower, on the record. Not going to affect anybody's benefit. The benefit amount is a little bit higher for survivor benefits. At full retirement age, 100% of the deceased workers unreduced benefit. Okay, we talked about that, right? Because if the deceased worker was receiving a reduced benefit, which means that they took their benefits before their full retirement age, the widow or widower or ex-widower is never going to see 100% of that benefit because it's already reduced. At age 60, it's 71.5% of the deceased workers unreduced benefit. And I gave you the scenario from one record, switch from one record to the other. And again, it doesn't affect the benefit, widow, widower, and divorced widow, whatever. Okay, lump sum death payment. Yes, don't rub your eyes. That is $255, not $2,055. That's one-time payment. Okay, so it goes to the surviving spouse. If there's no surviving spouse, then it goes to the surviving minor child. $255 lump sum payment, one-time payment. Disability benefits. I just wanted to cover disability benefits because a lot of people don't know that we have disability benefits. It's for people under the full retirement age. And the reason for that is because if you are approved for Social Security disability benefits, the benefit amount is as if you were getting it at your full retirement age, unreduced, 100% of your benefit. Now you do have to have a physical or mental condition, and that condition has to be pretty severe. Pretty severe where the person's not going to be able to work or go back to work for at least 12 months or more, or sometimes, unfortunately, the condition results in death, because we have all different types of disabilities out there. Again, just because somebody gets state disability or 70% VA is not going to automatically qualify you for Social Security disability. Anybody that applies for Social Security disability, it's not automatic that you're going to get monthly disability benefits. It has to go through Social Security's medical board. It is a separate application, and the application process does take a lot longer. So the interview, would take about an hour, hour and a half sometimes. The reason for that is because we ask you what doctors and clinics have you been to, get the address, the phone number, what kind of medications you're taking, have you had any tests done, did you have any emergency room visits. All of that information gets compiled into Social Security's records, and that gets sent over to Social Security's medical board. Here in the state of Hawaii, we contract with the state of Hawaii Voc Rehab to do all of our disability determinations. Now, the initial claims processing time, and what they do is they're going to request for all of the medical records from all the doctors and hospitals that this person has been to, and they're going to make that medical decision. So that medical decision, and there's a high volume of disability claims. Right now, it's taking them about 8 months, 6 to 8 months, just for an initial decision. And it's either 100% your claim is approved or 100% your claim is denied. It's not 50, there's no 50%. The percentage is 100% or nothing at all. Okay, so you either meet the definition of Social Security disability or you don't. Okay, so you do have to have now if somebody has a terminal illness, unfortunately, the last couple of weeks I have had people filing for terminal illnesses, stage 4 cancer. Those are expedited. Okay, they get flagged. There's what's called a compassionate allowance. Those get allowed within a week. Okay, once it goes through, then it's flagged, and then they immediately get the medical records that they need, and they process it right away. Okay. So if they are awarded for Social Security disability, the benefit amount is as if they were collecting it at their full retirement age, 100%. The only time a disability claim may be reduced is if someone's getting workers' compensation, because they don't take out taxes on that. So if they're entitled, then that would mean the spouse will be entitled and the child will be entitled for benefits. Okay, so don't shoot the messenger. This is IRS. Yes, Social Security is taxable. It is income. So if you wanted to have your taxes withheld from your Social Security check, you can go on to socialsecurity.gov and click under forms, and there is an IRS form W4B, and you can have whatever percent you want withheld from your Social Security check. Okay, everybody in this room should have at least once in their lifetime received a Social Security statement. She'll show you all the years you've worked and paid in Social Security, what you're going to get at 62, your full retirement age, 70, what you're going to get if you suddenly become disabled, how much your survivors will receive. And then we stopped sending them out because that costs billions of dollars to be sending it out to every American that's working into the system. Okay. So we've made it available online. Now, for those individuals who are not collecting Social Security benefits, it's the same thing like the statement that you'll be getting in the mail every year. Okay. You can actually print it out and get that information online. But of course, you do have to create an account. For those individuals who are already receiving benefits, you can actually get a benefit verification letter printed out for you, because sometimes people need to show another agency how much they're getting from Social Security, or maybe they need it for a loan. Okay? You can actually print it out. It'll go back 24 months to show what your monthly benefits were, 24 months back. It'll also show you whether or not you're getting Medicare, how much Medicare Part B premiums you're paying, if there's any overpayments. It'll also show overpayments. You can start your direct deposit, change your address, phone number. Lots of things you can do online. Medicare, I think Pamela Cunningham talked about Medicare, so I'm going to skip over all of these because she's already talked about it. But Medicare, there's other people that are entitled for Medicare, 65 and over, and then also people who are on Social Security disability for 2 whole years. They're also entitled for Medicare. I had one individual who was diagnosed with ALS and was approved for Social Security disability. The Medicare starts out right away for those individuals with ALS. End-stage renal disease, we have dialysis centers, throughout Oahu. We get Medicare applications because they do qualify for Medicare as well. The last one is only in the state of Missouri with the asbestos. Okay, so this has all been covered by Pamela. I think she gave out the 1-800 number. I have to give a spiel about the Affordable Care Act. You know as much as I do about the Affordable Care Act. And so they said, Jane, don't go into details. I don't know much details. But all they said was just make sure you just tell them to go on to healthcare.gov or contact the toll-free number, okay, 1-800-318-2596. There is going to be a lot more information about the Affordable Care Act come October. They're expecting this is supposed to be active come January 2014. Okay, but they have not given me much information, and they told me do not give that much information, but just give out the website and the 800 number. Okay, so I'm doing healthcare.gov. And that is our website. And that completes my presentation. Does anybody have any questions? No? Okay, every time people say, well, is Social Security going to be there for me? They're going bankrupt. I always tell them I was a Social Security recipient myself. I already collected benefits. They're looking at me going, well, how do you collect it? My father passed away when I was young. So I collected survivor benefits. My brother and I did. So did it help my mother in the time of need during that time? Yes, it did. Okay, so I always tell people, if it was there for me, it'll be there for you. Okay, there's going to be a lot of changes, and you're going to be hearing a lot about those changes, but it's here to stay. Okay? All right, thank you.